For today's Daily Dental Minute, we're going to talk about the sounds that patients make when you're working on them. Oftentimes, you'll have some patients that make more noises when you're working on them. I once saw a very interesting morning daytime show that was talking about the sounds that babies make. And there was a baby whisperer who came on, and she could tell by a baby's cry whether there was a wet diaper or whether they were hungry or if they were just cranky and annoyed. The sounds that sometimes patients make are communication. We in a dental office should be able to tell the difference between a gurgle, gurgle, I'm drowning, versus someone who's letting you know that what you're doing is uncomfortable or painful for them. Again, when you start to listen to what the sounds that patients make, you'll subtly be able to tell the difference between what each sound means. And when you communicate back to your customer, to your patient, what you think that sound means, then the patient will know that you're understanding them. So if a patient makes a noise and you think you know what that means, say it to the patient. Is that uncomfortable for you? Or do you need me to rinse? When you're positive and you're correct in what that sound means and you're communicating with your patient, they tend to get more trust with us. So again, pay attention to the sounds that your patients make when you're working on them in the chair. This is especially important for special needs children or for children that don't have the ability to use their words. Oftentimes as a parent, I'll say to my kids, use your words. But even adults sometimes need to use their words. Well, if they're not able to use their words, you, as the dental staff, need to understand what the sounds that your patient is making and figure out what they mean. This is your tip for your Daily Dental Minute. And as always, don't forget to make people smile.